What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for April 6, 2021. The harassment of health officers during COVID-19. Thank you, Johns Hopkins Bloomberg School of Public Health.
Harassment online. Harassment in person. Threats of violence and even violence itself. In the last year, amid the pandemic, public health workers have experienced more direct attacks than at any time in the previous century. I'm Lindsay Smith-Rogers, producer of Public Health on Call. This week, as part of National Public Health Week, we're bringing you a special 4-part series with episodes excerpted from a webcast from last month. The webcast was produced in collaboration with the Association of State and Territorial Health Officials, known as ASTO, the National Association of County and City Health Officials, known as NACHO, and the Big Cities Health Coalition. In this series, we will explore the extraordinary challenges facing the field of public health in the COVID era. We'll hear from health officers on the front lines about their experiences, from researchers about the scale of the problem, and from the leaders of ASTO, NACHO, and the Big Cities Health Coalition about what is to be done. In part 1, we'll hear a message from Dr. Rochelle Walensky, the new director of the CDC. Then we'll hear from 3 public health officers, Dr. Myshika Roberts, Dr. Greg Holtzman, and Dr. Jennifer Bacani McKenney, about the significant challenges they and their staff have faced during the pandemic.
If there is one aspect of public health work that is universal, it is that we are all committed to doing the right thing for health. I know many of you went into public health out of a desire to help others, and because you believe that all people deserve equal access to health. As we continue to face the COVID-19 pandemic, you, the public health leaders of this country, have faced unrelenting obstacles and public criticism while working to bring this pandemic under control. Yet you continue to lead with science, transparency, and equity. Science is and will always be the guiding light of public health. Transparency is how we ensure that there is trust in our data and information that is openly and objectively obtained, which is critical to driving decisions that save lives. And equity is our moral obligation because we must take actions to address inequities among disproportionately burdened populations. All of us in public health share these values. We must put science first and strive for optimal health and equity. I have been dismayed and deeply disturbed by what many public health officials and workers have experienced trying to do their jobs during the pandemic. I know it will take a long time to heal from these experiences. Tragically, 500,000 Americans have died from COVID-19. 500,000 deaths. Public health now is perhaps more critical than ever. This pandemic has humbled all of us, but we must remember that the nation, indeed the world, even when they don't express it and even when they don't know it, is counting on us. This pandemic has been exhausting, pushing each of us to our limits. Our tanks are empty, yet we have so much more terrain to cover. The criticism, mis- and disinformation, and lack of trust have been discouraging, even harmful. But it is important that we encourage each other and keep moving forward. We face many challenges that we must work together to overcome. This pandemic has highlighted our long-neglected, poorly resourced, and fragile core public health infrastructure. This must be addressed. We also have a nation to vaccinate against COVID-19, 300 million people. Public health leaders and staff, you, are the trusted source for the public. We can inform and inspire people to get vaccinated and stay safe. I want to encourage all of you in public health working in the trenches across the United States to remain resilient and hopeful. Your determination is inspiring. Keep fighting for public health. Keep doing all you do to bring our nation back to health. Thank you.
Next, we'll hear from Dr. Myshika Roberts, the Health Commissioner of Columbus Public Health in Ohio, about burnout for public health officers.
One of the things that I've experienced, and I know some of my fellow health commissioners around the nation have experienced, is, harassment and complaints from the public about some of the public health orders that have put in place. At times it got to be, somewhat personal. Some of the emails I received, especially knowing that I was following the science and I was following the guidance, and the case count in our community was extremely high. Our hospital volume was at a very critical level. So I was really following the science, but it's been an awakening to see how many people are really concerned about their own health or their own well-being and their own lifestyle, and not really taking into consideration those in their community and those who are around them. The first challenge that I faced that was really tough as an African-American woman was the call we heard from the community when testing was limited. What we were told by our hard-to-reach population, which includes our minority population, was testing wasn't accessible. I felt a sense of responsibility to meet the needs of the community, and I was fortunate that I was able to get my hospital partners to step up and provide testing here at the health department for those individuals who didn't have a doctor, who didn't have a healthcare provider, so they could come here regardless of their zip code, regardless of their income, regardless of health insurance, they could come and get tested. I have a phenomenal staff, and I really could not do the work that I'm doing, that we're doing, without some great dedicated staff. But people are exhausted. People are tired. People want to go back to their old job. Now they're working a vaccine clinic, or they're working a call center, or they're doing case investigation. And they want to go back to their previous jobs. And for the most part, that's just not an option right now, because our number one priority is getting our community vaccinated, followed by doing case investigation. I'm constantly trying to figure out how to motivate my staff, how to encourage my staff, how to get them to take some time off for themselves when they can. But it's not just the work that everyone's dealing with, but there also are issues at home. There are a lot of stressors that we all have, but yet for our industry, we've had to continue to move forward. So it's hard, and it's hard for me too. I had a few times in the last 11 months where I just got drained, and to the point that I almost made myself sick, and I had to heed my own advice and, take some time for myself as well. But it's hard because you don't want to miss a beat. You don't want to miss the opportunity to make an important decision. And so you keep powering through, even though you need to take a day off or rest some.
Now, Dr. Greg Holtzman, the state medical officer of the Department of Public Health and Human Services of Montana, talks about the misperception that evolving pandemic guidance was, quote unquote, flip-flopping.
It's been a very challenging year for so many different reasons. Obviously, other aspects of public health don't go away when a pandemic hits. We have the issues of the pandemic and the challenges that have gone on through there, and getting out the information and the science to the public to make informed decisions, and also to our politicians to make informed decisions. Some of the rhetoric and vitriol that's been out there has made it difficult to get a clear and clean message out to folks. Science got messed into politics, and we got comments about being flip-flopping and, that you're changing your viewpoints. And it's not a matter of changing viewpoints. It's a matter of using the science of what we have at this time and making an informed decision. We've had health officers who have quit. We've had health departments that all resigned. And it's been challenging in that aspect, where these people are trying to do the best they can with the amount of evidence and guidance that they're getting. And they're trying to do the things that are right to protect the community.
Finally, we will hear from Dr. Jennifer Bacani McKinney, the health officer of the Wilson County Health Department in Kansas, about her experiences with harassment.
There's been so much misinformation, so much fear, so much unknown in the general public. And sometimes that manifested as anger in those people. And when people are frustrated and they're being told that they have to wear masks or they have to social distance, they have to find somebody to blame. They feel that they can't really blame a virus that they can't see. So they tend to blame people like public health officials who are telling them to do these things or not do these things. And for me, that's been very personal. This is my hometown. This is where I grew up. This is where I was born and raised. And these are the people that I've cared for in my medical practice for the last 11 years. And when they have trusted me for the past decade, and then they start questioning my motivations and my recommendations, it really is hurtful. I've had somebody drive by my house videoing when they saw extra cars in the driveway, trying to say that I was not following my own rules. I was escorted out of a public meeting about mask mandates because the sheriff's department thought that I was in danger. And I've had people call for me to be fired on social media, saying that I was manipulating the commissioners, when of course we've worked as a team, but also, I've worked to advise the county commissioners because they don't have a health background. It's been tough. The county commissioners act as the Board of Health, and they are trying to do their job. But they also at the same time have told me that I focus too much on health and science and not enough on the economics of the town. At one point, they told me that they were going to open up their applications for my position because they didn't agree with what I was saying. And so when that information got out to the general public, I had so many people write letters and show up to the commission meeting to speak on my behalf and say, you know what, we do believe in what she's teaching us. We believe that she is keeping us safe and healthy. And that meant the world to me. I believe there are always more supportive people out there than there are people who are mean or hateful or angry. But those tend to be the louder people. And again, that can be a very personal thing in a situation like this. For all of us in public health, we've learned a lot, and we are going to continue on and continue to help keep people safe because it's the right thing to do.
Dr. Roberts, Dr. Holtzman, and Dr. Bakani McKenney are not alone in their experiences. Tomorrow in episode 2, we'll hear from two Johns Hopkins experts, Dr. Beth Resnick and Polani Moy, about the data showing the scale of the problem.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.